President, MDA executives here present, and other professional bodies here present, good morning. We are here today to study and discuss three bills of great consequence. They are a bill for an act to amend the National Primary Healthcare Development Agency Act, a bill for an act to establish a cancer registry to make provisions for the compilation of statistical record of the incidence of cancer, and a bill for an act to establish the National Blood Service Commission. Each of these bills seeks to achieve specific improvements in our national healthcare system. Together, they represent the most significant reforms to our national health system in the last decade. The requirement to hold public hearing is part of the legislative process. As part of the legislative process is a democratic tradition that guarantees every legislation passed by the National Assembly reflects the best expectation of those on whose behalf we hold office in Parliament of the people. These hearings provide an opportunity to engage with the major contributions of informed citizens so that together we can deliver legislation that is fit for purpose. These hearings also allows parliamentarians to listen to the concerns of our citizens, allay any fears they might have, and educate our people to understand the policy issues that inform legislative proposals. Therefore, I encourage all of you here today to participate in these hearings, knowing that whatever comes out of this process will have a substantial impact on our society for many years. When we gather, as we have today, to discuss weighty matters that have consequential and lasting impact on our society, I expect that there will be disagreements. We must not allow our interactions to be defined by these disagreements, especially when our objectives are the same: to build a healthcare system that works in the best interests of all Nigerians. For these hearings to serve their proper purpose, contributions from stakeholders must be well informed and thoroughly considered. Participants must therefore resist the urge to turn this into an arena for theatrics that serves no purpose other than inflaming passions and providing sensational content for the news. Finally, ladies and gentlemen, I thank all of you who have taken the time to be here today. I leave you in the capable hands of the chairman, Yusuf Tanko Sununu, and my honorable colleagues in the House Committee on Healthcare Services, and I wish you full deliberation. Thank you, and God bless the Federal Republic of Nigeria. I formally declare this public hearing. Thank you.
Thank you so very much, Your Excellency. I know you want to leave now, but before we allow you go, it is important for us to say thank you. Before I invite who will do justice to that, let me quickly inform our guest here that this hearing is live on NAS TV. It's live on Facebook. You can get us on Facebook or YouTube. On Facebook, type House of Representatives. And on YouTube, type NAS TV. You can watch this hearing live from your phone. Your Excellency, the Speaker of the House of Representatives, Right Honorable Femi Gbajabiamila, ably represented by the Chief Whip of the House, Honorable Mohammed Tahir Mongono, the Chairman, the Deputy Chairman, members of this committee, Honorable Minister of State, other invited stakeholders, members of the press, ladies and gentlemen. The hearing has been declared open. The representative of the Speaker will want to leave, but before we allow him go, let me invite the Deputy Chairman, House of Representatives Committee on Healthcare Services, Honorable Samuel Babatunde Adejare, to please help us say thank you to Mr. Speaker.
Thank you, MC. The Right Honorable Speaker, His Excellency Abdulhakeem Femi Gbajabiamila, heavily represented here by the Chief Whip of the House, the Right Honorable Tayo Mongunu, the Chairman, the hardworking, humble, reliable, dependable Chairman of the Committee of Healthcare Services, distinguished members of this committee, the Minister of Health, the Minister of State of Health, the country representative of WHO, the Director General of Primary Healthcare Development Agency, our other guests. My own mission here is so simple, and that is to say thank you not only to the Speaker, but to every one of us present here. But before I start, I want to say thank you to Almighty God for His mercies, for allowing us to be here as planned. Some people woke up the same way we did, and they are no more now. We are not using this to mock them, but to glorify the name of God. So we want to thank Him for giving us the enablement to be here alive. I will now say thank you to His Excellency, the Speaker of the House, for always being there for all of us, for all the committees, for all the members, and for always provided the leadership for all of us in this house and this country at large. We say thank you to him. May God continue to be with him and continue to empower him. Thank you to his representative and to all other guests. We are all, I'll say thank you to all of you for being here. As we know, as the Speaker will depart, the representative of the Speaker will depart now, the technical session will begin. So I'm not saying thank you to send all of you home, no, just to end this opening ceremony. Thank you so much. God bless you all. Thank you.
Thank you, sir. Your Excellency, we thank you for coming. Thank you so much. I think His Excellency wants to wait for... Oh, okay, you're leaving, sir. Thank you so much. We thank you so much. You can go, sir. Thank you. Thank you for coming, sir. That marks the end of the opening ceremony of this public hearing. We are now at the presentation stage. The stage I always refer to as the technical stage. And of course, as the master of ceremony for this hearing, my job ends here. I know Mr. Chairman is a very prompt and straightforward person. I wouldn't want him to throw me out of this hall. Mr. Chairman, yes. I thank you for allowing me to anchor the opening ceremony of this public hearing. You are in charge, sir. Thank you, sir.
Thank you very much. Please, we are going to the business of the day. But however, before we go into the rules that we guide this deliberation, it's always good to give honor to whom honor is deserved. The newly appointed country representative of World Health Organization, Dr. Walter Molumbo, was here with us, and he promised, despite the numerous courtesy calls and engagement he has today, he will be here during the opening ceremony, just to witness the opening ceremony. And he also demanded that he won't say one or two few remarks. So it's just my humble pleasure, with permission of the members, to invite the country representative so that he can deliver the few remarks before he takes leave. You can come to the podium.
the Chairman, House Representative Committee on Healthcare Services, Honorable Tanko Sununu, the Deputy Chairman, and other distinguished members of the House of Representative Committee on Healthcare Services, Honorable Minister of Health, Dr. Osagie Nanire, Honorable Minister of State, Dr. Mamora, other distinguished government officials, and esteemed participants, ladies and gentlemen. It's a pleasure for me to have been invited before you to witness this very important event, the hearing about 3 important bills. As you know, WHO has made its mission to promote health, keep the world safe, and serve the vulnerable. We realize that this cannot be achieved without strong primary health care system, which has been chosen as a bedrock for our road toward achieving the health-related sustainable development goal in Nigeria. And we were proud that Nigeria was part of the countries that supported the new global program of work, the 13th global program of work, and is tenet around revitalization of primary health care. So it's with great pleasure that I can witness and attend the discussion, the hearings on this bill related to primary health care. As you also know, the security of blood is paramount to ensure we save lives, particularly for the most vulnerable, the pregnant mothers who come to deliver. Nobody should die because he's giving birth. So it's very important that we attend this and continue to support. And then the last bill regarding cancer registry. It's very important as WHO has adopted a number of strategies to eliminate cancer. But to eliminate cancer, we need the right policy in place. To have the right policy in place, we need the support of legislators. So that's why it's very important that we ensure that the data that needed to inform policy and practice are captured, and we are very, very pleased to know that this hearing will provide framework for Nigeria to improve the services in that particular area of cancers. Thank you very much for inviting WHO. We really look forward to discussions, and I would like to commit WHO to continue to support the committees until such time as this bill are appropriated. Thank you very much.
Thank you very much. So you can, the country representative of WHO, thank you very much. If you wish, you can take a leave on behalf of the committee and the entire National Assembly, especially House of Rep. And Mr. Speaker, we want to express our gratitude and thanks for you to be here to witness our deliberations. We shall continue to partner with the World Health Organization in promoting best practices in healthcare delivery in the country. Thank you very much. Yeah. Well, it's my pleasure to invite the Deputy Chairman of the House Committee on Healthcare Services, Right Honorable Babatunde Samuel Adejare, so that we can adopt rules that will guide the conduct of debate and deliberation in these sittings.
Thank you, my chairman. Distinguished honorable members here present, the Minister of Health, the Minister of State of Health, country representative of the WHO, our other guests, the President of Nigeria Labour Congress. I just want to say that, as you know, this is an extension of the plenary of the Federal House of Representatives of Nigeria, and as such, the proceedings here will be governed by our rules. And they are not out of these world rules. Our chairman will recognize who is to talk at every point in time. If you are not recognized, you will not be allowed to talk. You are not to talk. We are governed also by all the protocols of the COVID-19 pandemic protocols here. And that's why it took some time for the registration to be concluded this morning. And that's why there is social distancing here. We want you to always put on your mask throughout your duration of time here. And because of this, we will also limit the time of our stay in here to as short as possible. Please, we hope and pray that we have a fruitful deliberation here. Thank you so much. God bless you. Thank you, Chairman.
Before we are going to do it in the order of remarks by the bill sponsors that are here, followed by the remarks by the Honorable Minister, NDAs, professional bodies, and general public. So it's my pleasure to invite Right Honorable Abbas Tajuddin to present his remarks. Any other, please, sponsor of one of the bill. If around, please indicate. But before then, some of our members join us after the opening ceremony. So I will call on those who are not who are around now to introduce themselves, and thereafter the minister to introduce his team. Thank you.
Thank you.
Oh. Extreme right. That's the chairman COVID committee, who also doubled as my lecturer in the university. Right Honorable Michelia has been a source of inspiration to me in this committee. Thank you very much, sir. Please, can you introduce yourself?
Thank you, our able chairman, honorable members, ministers, other distinguished personalities here present. My name's Honorable Dr. Haruna Michelia. I represent all the good people of Askra Bahawul Federal Constituency of Borno State, member of this committee. Thank you.
Good morning, Mr. Chairman, respected colleagues, the Honorable Minister and his team. My name is Honorable Taiwo Oluga, member representing Irewole Federal Constituency. I am from Osun State and a member of this committee.
Good morning, Mr. Chairman, honorable colleagues, honorable minister, invited guests. My name is Honorable Barrister Boniface Semerogwa. I represent the group people of Ikwere, Imo Federal Constituency in Rivers State. I'm from Rivers State.
Thank you, Honorable Chairman, Deputy, honorable colleagues. My name is Sam Ifeanyi Ondun Igbo. I represent the good people of Great Ikuano, Umuahia North, Umuahia South, Federal Constituency. I'm from Abia State. You are welcome.
Good morning, Deputy Chair, Chairman, Deputy Chair, Honorable Minister, distinguished colleagues. My name is Honorable Adedeji Stanley Olajide, member representing Ibadan Northwest Southwest Federal Constituency. I'm from Oyo State, a member of the committee.
Thank you, Mr. Chairman, Deputy Chairman, honorable colleagues, the clerk of this committee, our invited guests. My name is Benjamin Okeze Carlo. I represent the good people of Nigeria, starting from Bende Federal Constituency. I am from Abia State and a member of this committee. Thank you and welcome.
Mr. Chairman, Deputy Chairman, honorable colleagues, honorable Minister, my name is Abakar Abdullah Ahmed, representing Sokoto North, Sokoto South Pereira constituency. I am from Sokoto State. Thank you. Not the least, the immediate past chairman of this honorable committee has also laid a very good foundation for us to start and dance and jump without breaking.
Thank you very much, my honorable chairman, deputy chairman, very distinguished colleagues, the honorable Minister of Health, and all our invited guests. My names are Chike John Okafor. I represent the good and enterprising people of Ehimembano, Ihite Uboma, Ubo Federal constituency. I am from Imo State. You're very much welcome.
Deputy Chairman, honorable members, and honorable Minister, before the introduction, I knew that the statement is that teachers, their reward is in the heaven. But I do believe that the reward of teachers should not only be in the heaven, they should also be recognized for what they have done. Among us here is a retired administrator, a teacher to my deputy who has mentored him over the years at College of Health Sciences, University of Ilorin, Dr. Fakai. Please can you stand for recognition? He's a teacher to Right Honorable Dr. Babatunde Adejare. Just as I mentioned of my teacher, Dr. Honorable Haruna Meshelia. Please stand up for recognition. Right Honorable Haruna Meshelia, please stand up for recognitions. Thank you very much. Honorable Minister, please you can introduce your team and then you deliver your remarks. Once you can use the podium, sir. You have that.
With your permission, I think we'll just introduce ourselves from our seats so that we don't reduce the shuffling around. Yeah, Mr. Chairman, Vice Chairman, honorable members, Honorable Minister of State, the representative of the World Health Organization, the Executive Director, National Primary Healthcare Development Agency, National Coordinator of the Blood Transfusion Commission, the Director of Hospital Services, all other directors and members of the House, and also staff of the Federal Ministry of Health have established the protocol for everybody. My name is Osage Ihanire. I'm Minister of Health.
Please, the Honorable Minister has established protocol very well. We are adopting that, so no need, whenever you are going to speak, please go straight to your point so that we cannot waste time in protocol. The ministry, because it's the parent body, is going to say a lot, will be given 20 minutes. All other presenters will be given 5 minutes. If you come, go straight to your point. Go straight to your point. If you have memorandum of the 3 bills, please use that time to state your position on each. Go to specific areas. We already have your both soft copy and hard copy of your presentation. So it's just here to emphasize why you think more attention should be given. If you dwell much time on protocols, you are using your time. So as to save time, because it's even by the protocol, we shouldn't prolong our meeting. That's this. Honorable Minister, you have the floor. The Deputy Chairman will keep the time for. Okay, the introduction. Yes.
Thank you very much, Mr. Chairman and honorable members. I am Honorable Mbemamura, Minister of Health, State. Thank you.
Thank you, Chairman. I am Dr. Joseph Amidu, member of the National Institute, National Coordinator, National Blood Service Commission. Thank you.
National Primary Healthcare Development Agency.
Good morning, Chairman, distinguished members, Honorable Minister. My name is Faisal Shuaib. I am the Executive Director, Chief Executive Officer of the National Primary Healthcare Development Agency.
behalf of all Nigerian workers, you can introduce yourself. NLC President.
Thank you, Chair. I think you have already said we should adopt the protocols. My name is Ayuba Waba. I preside over the Nigerian Labour Congress. Thank you.
As a Nigerian Medical Association, are you around? Please quickly introduce yourself. Only the
Dr. B. Phillips Uche. I represent Nigerian Medical Association. Unfortunately, there is another public hearing at this Senate, and so the president of NMA is there while I represent NMA here. Thank you, sir.
Okay. Medical Health Workers Union. Please introduce yourself quickly.
Thank you, Chairman. I am Tony Ogagmo. I represent Medical and Health Workers Union. Thank you.
Nurses and Midwifery, NAM, National Association of Nigerian Nurses and Midwives. Please.
I am Comrade Nurse Adeniji Abdurafiu Alani, MNI, the President of National Association of Nigerian Nurses and Midwives.
Nigerian Association of Resident Doctors, are they represented? Please introduce yourself quickly.
Mr. Chairman, my name is Dr. Soleko Ikuduwe. I'm representing the Nigerian Association of Resident Doctors. Thank you, sir.
Medical Laboratory Sciences Association, are they represented?
Yes. Mr. Chairman, my name is Dr. Kashba Ifeanyi. I represent the Association of Medical Laboratory Scientists of Nigeria.
I would want to call on the Honorable Minister of Health to please deliver your speech. Oh, you say you prefer there, but you know, orthopedic eyes are usually very, this is strong.
Mr. Chairman, the protocol is already established. I only need to recognize the gentleman who presides over the Nigeria Labour Congress, Mr. Ayuba, welcome, and also the representative of the Nigerian Medical Association, our association, and also the representatives of all other medical and health-related associations. I shall just go ahead and speak right away about the three positions. The Federal Ministry of Health is delighted to be at this public hearing for the establishment of the Blood Service Commission, which will vastly boost the quality of blood services provided across the nation and lead to a significant improvement in health outcomes. There are significant variations in the availability, quality, and safety and use of blood and blood components provided in both private and public health establishments at the moment, exposing citizens to risk of infection with transfusion transmissible diseases such as HIV, hepatitis, and syphilis. The Federal Executive Council had, in a memo in 2017 and 18, endorsed the establishment of the National Blood Service Transfusion as a commission to help address some of these variations. Barriers to a well-functioning national blood service include inadequate regulatory framework and resource limitations. The establishment of a National Blood Service Commission is something we have looked forward to because it will effectively address these barriers. There is also need to address the variability of quality and service which is required for a national blood service, and we need one that is empowered with the requisite legislation to safeguard blood transfusion value chain across health facilities, from point of collection to storage, screening, transportation, and finally blood transfusion in adherence to establish global and national guidelines. That under the current structure of the blood transfusion service, the quality of blood service provided across the country cannot be safeguarded because there is no existing legislation in Nigeria to coordinate, regulate, and ensure safe blood transfusion practice for the country by effecting compliance of health facilities to national guidelines. For a country of our size, and for our also regional and global importance, the present state of affairs regarding blood transfusion in the nation is undesirable. Honorable Chairman and members, the issue agree that that a clear framework is critical to ensuring protection of lives, health, and well-being of citizens. The current lack of legal backing for NBTS role of ensuring blood safety in the country severely hinders its ability to perform these roles effectively. This has affected implementation of the National Health Plan and impeded achievement of sustainable development goals and universal health coverage. The establishment of a National Blood Service Commission therefore has several clear merits. First, the management of medical emergencies requires that adequate supplies of screened blood and blood products are available in national and regional blood banks at all times. Secondly, blood safety regulation will guarantee dedicated funding from federal government for the operations of the blood service and facilitate opportunities for robust multilateral partnership. Thirdly, the proposed bill, when passed into law, will establish a commission that will coordinate blood transfusion practices on a country-wide basis within the National Health Plan and act as the sole regulatory and accrediting authority for blood services nationwide, thereby protecting Nigerians from risk of transfusion with unsafe blood. Finally, it will also enable creation of a national blood service that could be activated when there's a national disaster as occurred during the 2014 bomb blast. Recommendations from the World Health Organization state that a national blood service should be funded from national budget. Consequently, funding will be required from the federal government's annual appropriation for the takeoff of the commission and for subsequent operation on an annual basis. The Blood Service Commission will be able to generate significant financial returns for government through the production and sale of a suitable range of therapeutic blood products by blood fractionation, and such as plasma and plasma derivatives of medical products locally, regionally, and internationally. This means that it's possible to export the blood derivatives when it is put in place. This will not only create jobs and yield additional income, it will also reduce the pressure on national budget by generating revenue. In conclusion, the Federal Ministry of Health reiterates its support for any progressive initiative that improves health outcomes and benefits health and well-being of Nigerians. The National Blood Service Commission Bill is therefore endorsed by the Federal Ministry of Health because of its overarching goal of protecting the health of Nigerians and providing an enabling environment for an enhanced access to quality healthcare services that are available and affordable to all Nigerians. Thank you for that first one. National primary health care. I will ask your permission, Honorable Chairman and the members, after my presentation, to go and join the PTF meeting, which is starting right after, and lead all the technical officers here. I'm also pleased to be here for this important occasion in respect of National Primary Healthcare Development Agency Act of 1992, which is being amended. We support today's event because it contributes towards strengthening the roles and responsibilities of the National Primary Healthcare Development Agency to provide technical and programmatic support to the states and local governments on the development of primary health care in Nigeria, which will ultimately improve overall health outcomes in the country and accelerate our journey towards universal health coverage, which, as we know, is a cornerstone of the President's agenda. We appreciate the support of all honorable members here in this House and the chairman and members of the committee and the National Assembly and their support and oversight towards improvement of primary health care in Nigeria. We also recognize that significant changes have occurred within the national and global primary health care landscape in the past few decades, including continual changes in the fiscal space, innovative technology, health security, the nature of infections and emerging diseases, and the basic demographics of Nigeria's population. The transformation has expanded the role and responsibility of public health agencies globally beyond direct service delivery to program management, quality control and standards, and performance monitoring and enforcement, which have added new layers of complexity to primary health care and national immunization systems that must be examined through the lens of coverage rates, service delivery patterns, and improvement in the standard of living of our people, which is the ultimate goal of the Ministry of Health. NPHCDA has encountered some challenges and operational limitations in discharging its mandates as an agency. The Federal Ministry of Health is undaunted in our collective vision to make primary health care services available to all Nigerians as the cornerstone of the administration of President Muhammadu Buhari. Our journey to a rebranded, transparent, professional, and effective agency has been characterized by many successes, and it is significant to note that Nigeria has been declared wild polio virus free and will, in a ceremony, be certified free of wild polio virus by the World Health Organization in August of 2020. The achievement of polio-free status is a hard-won battle spanning over 3 decades of hard work and dedication of the polio team, partners, and donors through years of the defunct National Program on Immunization to the National Primary Healthcare Development Agency established by an act of 1992. We salute all those Nigerians who participated in this struggle. However, from the technical point of view, the transfer of the functions of the NPI to the agency with regard to polio eradication initiative and routine immunization was not completely captured in the current act. The amendment of the current act will provide an opportunity to highlight and strengthen our mandate to serve Nigerians better and ensure that basic healthcare services are equitable, people-oriented, and delivered in accordance with established quality standards and protocols. Some of the amendments and additions include the following. In Part 3, 4B, we have now incorporated the establishment of technical support programs. 4J, we have better captured our role to promote accountability for primary healthcare systems through periodic performance review of the activities of the state primary healthcare boards. 4N, we have fundamentally incorporated the core responsibilities of the defunct NPI into the functions of the National Primary Healthcare Development Agency, that is to plan, to procure, to administer, and recommend appropriate vaccines into the national immunization schedule. Part 5, for the purpose of effectively discharging its functions and mandates, the amended Act has incorporated a decentralized approach in accordance with geopolitical representations. The establishment of the State Primary Healthcare Board in 36 states and Federal Capital Territory, thereby improving the roles of the provision of technical and programmatic support to states and local governments. Part 6, the agency, subject to the provision of National Health Act, shall periodically review primary healthcare standards in the states and the implementation frameworks and protocols by states and local governments where applicable. The Federal Ministry of Health therefore supports the move by this Honorable House to amend the NPHCDA Act in line with the current realities and the needs of the agency and of Nigeria. Working with our development partners, donors, civil society organizations, we shall continue to keep our promise of changing the face of primary healthcare delivery in the country, which is the foundation of all healthcare delivery. We have made all this progress with visionary and passionate leadership provided by the President of the Federal Republic of Nigeria. Thank you, Mr. Chairman and honorable members, for this invitation to be part of this discussion. Mr. Chairman, the third one is the one which we do not agree with, the National Cancer Registry, and I will state right away that cancer registration is a means by which information on all cancer cases is collected, coded, classified, in order to produce statistics on the occurrence of cancer in a defined population in a specific time period, and to provide a framework for assessing and controlling the impact of cancer in the community. The Federal Ministry of Health established the National Headquarters of Cancer Registries in Nigeria in the 1990s to coordinate cancer registration and the activities of cancer registries in Nigeria. This was domiciled at that time at the Department of Surgery, University College Hospital, Ibadan, under the pioneer chairmanship of Professor Sholanke, and the National NHRCN, despite several challenges due to inadequate funding, recorded successes. It later metamorphosed into the National System of Cancer Registries, NSCR, in 2009, with expansion to other institutions that have the capacity to diagnose and treat cancers in Nigeria. The activities of NSCR are largely funded by the training grants from the Fogarty International and the Federal Ministry of Health. The NSCR, which is currently being directed by Professor Clement Adebamowo, who was trained by Professor Sholanke, engages in establishing new cancer registries, strengthening existing registries, providing training and mentoring for cancer registries, and monitoring the data generated for completeness and accuracy. The NSCR is under the control and supervision of the National Cancer Control Program, Federal Ministry of Health. It carries out regular site monitoring visits and provides technical and